Good afternoon, everyone. Thanks for joining us on our monthly business town hall. Just want to remind everybody, at least initially right now, please mute yourself. We've got the mayor here. We have city staff who's available to answer some questions. We're going to run through a very brief presentation that's going to cover two basic items. Number one, we're going to give you an update on the COVID data as it stands right now. And we're also going to talk about some of the reopening announcements that we made earlier this week and what that means for businesses. And then finally, we'll do questions and answers. And when we do get to the point of question and answering, if you're interested in asking a question, you can raise your hand virtually, and I can recognize you and allow you to unmute yourself and then ask a question, and we'll be happy to answer that. And we're going to get going right now. Mayor Joe Curtatone is here, ready to start. I'm going to share my screen so you can see the presentation. Just a second. And thanks for joining us.
Great. Tom, sound check. You hear me okay?
I can hear you loud and clear, Mayor.
Great. Thanks, Tom. Thank you, everyone, for joining us, and good afternoon. I'm going to be brief in my remarks and just go over in terms of the data and the context of where we are in reopening, how we hope things will be rolling out down the road to the best we can, and some other announcements around vaccines. We certainly want to leave enough time to answer your questions. First, I once again want to thank you all for working and supporting the community's efforts to manage the COVID-19 crisis. It's, as we've all noticed, it's cost us an immeasurable toll for our lives and conveniences, obviously, to our mental health and well-being. We pay for it in blood, 85 deaths as I speak with you today. And that's important things to keep in mind in our compass, but obviously to our economy as well. So as we mentioned at the last business town hall, and when we came to around mid-April, there were two, amongst many other factors and variables, there are two important ones we were going to monitor. Is where are we on the variants? Where are they going to take us in the wrong direction in a statistically significant way? How big would the surge be? And where are we in our efforts to vaccine our population, most importantly, the most vulnerable in our population, who continue to get sicker and die at higher rates than many of us. That being said, I want to give a snapshot of some of the data we've been monitoring, and I'll hand it back to Tom and then answer any questions. I'll start off by saying this past year plus has not gone by fast. I think we all know it's been grueling. It's been treacherous, and we're not done. Again, we might be done with COVID, it's not done with us. So as we move forward, it's not declare victory. Let's be vigilant. Let's continue to make progress. Let's get back to some semblance of normal. It's going to take time, but we're cautiously optimistic. We can see around the corner. Now we need to get there. I do want to recognize, and if I missed any others, at least initially, I saw a city councilor from Ward 7, Tatiana Valentine, on the call. Thank you, council, for joining us, in Kristen Strezzo. And if there are others, I'll come back and recognize. I apologize. I just noticed you two first. Thank you for joining. Okay, let's take us through the slides, Tom. Next slide. First slide, I should say. This is the confirmed cases. Now, the purpose of this slide is we're obviously nowhere near the lowest point we ever observed. But the fact is, as we go through these slides, for context, trending in that right direction. Snapshot back several months to July 4th on the number of confirmed cases to where we are now, but again, trending in the right direction. And again, still several times higher than we were back then. Next slide, please. Hospital admissions, again, certainly lower back in August. And it's still several times higher, but trending in the right direction, as is illustrated in this chart. And folks, again, as we go through this, if you have questions about any particular data point, just when you raise your hand or put it in the chat function, we can either answer verbally or provide you more data as well. Next slide, please. On deaths, we don't all see it up close. It is happening in 85 in Somerville, more than 17,000 here in the Commonwealth, and hundreds of thousands in this country, and it's continuing. Remember, people are continuing to die from COVID. Going back to just from April 20th to where we are now, the 7-day average from deaths was the same value as the lowest observed value. It's important. And this is one of the values you look at. Next slide, please. And the percent positivity. Again, going back to where we were, the lowest observed value back in September, several months back. And then on April 21st, the 7-day average, still 3 times high, but once again, trending in the direction we want to see at. Next slide. And a number of positive cases in some of them. And again, you can see the wave and different waves and where we were back last July at 1.14, and on the current 7-day average up to April, which was one on April 16th, is still much higher than it was then, but we see once again this continuing in the right direction. The fatalities in this slide is incorrect, but 85 souls we have lost in some of them. Next slide, please. Now to the vaccines, and the important thing is the vaccines do work. If you don't believe in them, well, then I hope you can at least read data and listen to it and hear it. And we'll go through it right now. Next slide. The vaccinations, the number of people in our population, we've seen a steady climb. I will submit, and I will continue to argue the rollout was at best a disaster, certainly initially, and it's still not equitable in terms of access, but we're making progress. This is what's important. And I'll talk about the equity piece, which we're most concerned about, but we are trending well in the right direction. You can see fully vaccinated, meaning you had, whether it's the J&J 1 dose necessary for full vaccination or 2 doses, either Moderna or Pfizer, well over 20,000 residents, and some of them partially vaccinated, meaning you had 1 of the necessary multiple doses, is approaching 20,000. I have my first dose, and we'll talk about what you all need to pre-register if you haven't done so. Next slide, please. Of a big concern, and it should be for everyone, is where our most vulnerable, we're trending in terms of equitable access to the vaccines. And then we're very vocal along with other municipal officials and local leaders, as well as countless others. Right now, if you look at the number of fully vaccinated people, and that's as you're looking at the screen, the left screen, they're trending in the same way as the previous screen. However, when you break it down demographically, there are still gaps, and the gaps are significant. Our Hispanic population is not even just below 15% compared to now 30 plus for white residents. You can see our Black residents are still statistically significantly behind that, and Asian residents as well. When you look at the partially vaccinated slide, it's similar, although it seems that Black residents, they're now significantly below Asians. However, this was a lot different a few weeks ago. I'm sorry, just let me take a peek at the next slide, Tom, before I go into this next point, or else we'll go back. Go back one slide then, I'm sorry, I thought there was another one. So what I was gonna say is a few weeks ago, even Christine, correct me if I'm wrong. No, go forward one. A couple of weeks ago, about 23% of our residents as a whole received some vaccination, and that was pretty consistent for white residents. However, at that point, and I'm approximating best of my recollection, and Kristen, tell me if I'm way off, only between 4 and 6% of our Hispanic residents were, and I believe 12 to 15% of our Black residents. I can't remember the Asian resident number, but well below. So that was something we've been paying attention to. As I mentioned at the beginning, I said at the previous town hall, where are we in terms of the variants? These are the leading experts in the world, so we should pay attention to. And where are we in terms of vaccinating, at the very least, our most vulnerable? So from what I've mentioned, I stated clearly enough where we are now, although they're still behind those, because there is a major gap in terms of how we understand equitable access to vaccines. We have made significant progress in the city here. I want to give a big shout out, at least in Somerville, to the ICS, the Immigrant Services Committee, the ISC, and sorry, the ISC, the Immigrant Services Unit, Doug Kress, and the community all working together, as well as advocacy agencies and organizations in the city working together to get the word out, and the business community. I can't tell you how much those signs in front of your businesses with that simple saying fully vaccinated just reinforces the need to work together and get us to become all protected. I'd say that's all had a big impact in having a very low vaccine hesitancy rate and getting people out to be vaccinated. I'm going to stop there, and that gives the context behind the opening announcement we made a couple of days ago. I'm going to hand it off to Tom, and then we'll entertain all questions we have on the slides I presented, slides Tom will present, or anything related. Thank you.
Thank you, Mayor. And again, because things are trending in the right direction, it seems as though that fourth wave, so-called fourth wave, we've handled, and we're seeing the vaccinations happening. And so we're now in a place where we're ready to move on to the next phase of a reopening step. And so that means what we announced on Monday, this past Tuesday, was on May 7th, we're going to move to a modified phase 1, step 1. So the following slides that I'm going to show you all relate and are all synced up with an opening on May 7th. So 1 week from tomorrow. So the major piece is that a number of different business classes can now operate at 50% capacity on May 7th. And this includes our restaurants, our offices, our retail stores, fitness centers and gyms, all of our personal services, hair, nails, massage, etc. And also for the first time, movie theaters can now open up in Somerville on the 7th. At 50% occupancy. Also, indoor recreation will all get bumped up to a full 50% capacity, and also bingo halls and any other business that's listed under phase 4, step 1 of the state's reopening plan. Almost everybody has been held to 25%. Some indoor recreation have been relegated to even a smaller percentage than that, and we're moving everybody up to 50% as of a week from tomorrow. Of course, all this still in place is the required social distancing and following all the city and state rules regarding different guidelines for each business class. We have some news to report about outdoor public events and spaces, and we will be increasing the capacity for those outdoor events to 150 attendees. And we will also allow singing while masked, which is a new thing. We've allowed spoken word, we've allowed dance, and now we'll allow some singing and woodwind and brass instruments. Of course, they'd have to be extra safe by keeping 10 feet away from each other performers. And also those performers must be 25 feet away from the audiences. But, and then also in order to do any outdoor events, you're going to need to submit to us a whole plan. So a health and safety plan based on your event or based on your venue. And for indoor events, we are increasing the capacity to 100. And so that includes meetings and convention spaces. And those indoor performance areas will be subject to either the 50% capacity or the event gathering limits, whichever is the more conservative. And all performance types, except for singing and woodwind and brass instruments, are allowed. Just the woodwind and brass and the singing are prohibited. We're not going to allow that indoors yet. And of course, our caveat with all these reopenings is that you need to submit a health and safety plan or an updated health and safety plan before you're allowed to open. And so that leads into my next slide. What do you need to do? Well, for those of you, and many of you fall into this category, you've already submitted a health and safety plan. You just need to modify those based on your addition, your new layout, if you're allowed to increase that capacity and you have the space in your facility to do so. If you're a business that already submit your permits through CitizenServe, you're going to need to upload a revised health and safety plan under your existing license. So that impacts mostly restaurants that are operating indoors. And then all other businesses, that includes our barbershops, our hair salons, even our indoor recreation businesses, and the others that have needed approval from us before they can reopen, they're going to have to submit those directly to ISD's email address at isd@somervillema.gov. And we've also set up a page that really outlines and puts together all the existing HASP templates and instructions and how to prepare a health and safety plan. If this is your first time, you can find those at somervillema.gov/HASP, so HASP for Health and Safety Plan. We also announced, if I can turn, oh, hold on, I skipped the slide. Oh, I had another slide here. Let's see, maybe I skipped it. Looks like it got lost, but we did also announce other non-business related openings. For instance, houses of worship can open to 50% with an approved and expanded health and safety plan. We also have announced that we're going to keep at the same level our private gathering limits. So, and actually, I don't see it in front of me. I believe maybe Kristen or Nick can jump in and remind us what those limits are right now for private gatherings at your home or in your backyard.
So correct me if I'm wrong, Nick, but it is 10 individuals indoors and 25 outdoors for private events. This is in your residence.
That is correct.
Thanks, Kristen. So that's what we have to announce this afternoon. Of course, many of you know that the governor made an announcement, I believe on Tuesday as well, to talk about mask requirements and also a longer term schedule over the course of the summer to reopen the economy fully. We're taking, well, at least for all those reopening guidelines, we're taking a look at those very closely and haven't made any determination just yet, but we're working on a series of recommendations that perhaps will match what the state does in certain circumstances. In other circumstances, we might need, because we're the densest community in the Commonwealth, might need to delay some of those timelines that the state has outlined. We'll have more information about that in the coming weeks. And with that, we're all happy to answer any questions. We've got a full roster of city folks who many of you know, because we've been dealing with you and engaging with you over the last couple of months. We've got Kristen Stelgis, who is our ICS chief, who's handling the COVID response. We have Nick Antanavica, who's our director of Inspectional Services. We have Doug Kress, who's our director of Health and Human Services. We also have on the line too the rest of the economic development team with Nick Schoenberger, Daniela Carrillo, and Rachel Nedkarny. We're all here to answer any questions you might have. So I will take the screen off right now.
Yeah, and I'll handle you're gonna facilitate the questions. But I do want to welcome Rachel folks to the organization. It's the first time I haven't really met any new folks in person last year, but Rachel is the first public meeting she's in. So join me in welcoming Rachel Nedkarny to the economic development team. We're excited to have her on board. And so thank you. Tom, you'll facilitate the questions. If you got them, folks, we're here to answer. I do want to say, let me right off the bat, again, I understand the announcements about the August and the rest of the economy. We have a ways to go. I will underscore, we are cautiously optimistic. Let's do where we're at well. Let's continue in the right direction and keep our fingers crossed we'll get there. Right now, as I've been telling, we're trying to get our community to the next week and the next month, and we're going to get there eventually. The other thing is on the vaccines, after Doug speaks, we will be announcing some very good news that we're finally also going to get allotment to the regional site, which will be run out of Somerville. It will be regional, so the allotment will be for the other several communities in the partner region. But that's important as we try to strive for more equity. We'll be able to, I believe, Doug, you can correct me, peel off some that we can target some of our vulnerable residents who just can't get to the Hines now. So that's all positive news and factors into our thinking and decision making. I'm going to stop there and leave this time for all of you to ask any questions you may have, and Tom will facilitate. Yeah, thank you.
Thanks, Mayor. And so you can ask your questions one of two ways. You can submit your question into the chat, or you can raise your hand, use the reaction icons on your Zoom format, and just raise your hand and I can unmute you and get you ready to go. I see a question in the chat. RX Strength Training has a question that they actually emailed us yesterday. I'm going to look up that question right now. Unless you want to unmute yourself and ask that question directly, we're happy to answer it.
If I may, Tom, I have that question. That is the question that they were referring to was an occupancy question that was issued as part of the initial approvals last June and July when we were initially opening up. The updated occupancies that we have now for the half plans will align with what we had in this presentation. So we'll be moving those to the 50%. So we'll have the updated occupancies that you have on there to give you the direction for where you're at.
Thanks, Nick. We've got two raised hands. I'm going to take Matt Payton's question first and then Zach Baum second. So I think you can unmute right now, Matt, and go ahead and ask your question.
Perfect. Thanks, Tom. Can you hear me?
Loud and clear.
Great. Thanks for doing these meetings. We really appreciate, the opportunity to have an open, back and forth dialogue. So I really appreciate it. I'm the owner of Urban Axes in Union Square. I guess my question's for both the mayor and probably for Doug Kress. And I think it's fantastic that there's going to be more availability of the vaccine to some of the underserved communities. I'm on Team Moderna. I was part of the trial. So my wife got her first shot back in August and October last year, whereas I got the placebo, but I got my dose as part of the trial in January. There's been articles that have been released saying that the US is rapidly approaching its ceiling on voluntary vaccine adoption rate. KFF, which is a big health nonprofit and think tank out of California, has said that they think 61 to 66% is about the rate that we can expect for voluntary vaccinations. And Massachusetts, I think, has done a fantastic job overall in terms of number of people vaccinated. If you look at eligible population, I think it's about 60% already for 16 and up. And I think Somerville, the number right in front of you, Somerville's data for April 22nd, so it'll update again this week. It's 63.5% has already received their first dose. So we assume 3 to 4 weeks from now, it's going to be at that level that they're expecting as the ceiling. And vaccines are available now same day, basically, in Greater Boston. You can go on and you can find a spot and you can get a vaccine if you've got the ability to get to that shot. So looks like I just got muted. Am I still there? I was just saying, how is the city approaching once that ceiling is hit and people are no longer volunteering to get vaccinations, which it could be in the next 3 to 4 weeks. What happens then?
Doug, let me start off and I'll have you say it. Thanks for the question. Yeah, if you, I don't know if that 2 to 3 weeks is correct. I'll say, if the estimate is between 60 and 65%, well, there's still a significant portion of our population, our vulnerable population, who's not even near that. That has to be our target right now, my concern. So we'll formulate that data with everything else. I'll only lecture on vaccine effectiveness and goals as much as I am educated towards. So we'll listen to that expert opinion, that data, that advice, and make informed decisions. But I'll tell you right now, nowhere near, as you see in the chart, are the most vulnerable people in our community. Our Hispanic population, we make the bulk of the immigrants and vulnerable residents in Somerville, and others who are not near that big, that percentage as you mentioned. So our focus has to be there as well as everyone else. Doug?
Yeah, I think I'm going to echo a couple of those comments. We still have a distance to go, and I think there are still a lot of people who still want to do it. And I think one of the things that we're seeing here in Massachusetts is we're actually above and beyond what most of the other communities are looking at. And I think our compliance rates can be much higher than that, which is fantastic. We can do better and we will do better. So, but we all have to do that as a joint. We all have to continue that messaging that vaccines are important if we want to get back to additional normalcy and really kind of move us back so we can move beyond the current state of where we're at within COVID-19. I agree with the mayor that there's certain populations that still have not been reached, and that's part of the reason why we're moving forward with the regional approach and the regional vaccine centers. That's bringing the vaccine closer to individuals. And I think, Matt, you even mentioned it, for those who can get to those sites, there's still a big gap for people, not just to get there, but to get registered for some of those because it's all online. And so one of the things that, as you said, some people are now able to do some walk-ups. And I know BMC today is announcing that they're doing more walk-ups that are going to be available at some of their sites, which is fantastic. But again, there's still that limitations of getting there. We need to continue to educate people and remind people to get out and get vaccinated. We need to make sure that the vaccine is closer and remove any of the barriers that people may have either to access it because of transportation issues or because of technology issues. We also need to remind people that the vaccines work and that in order for us to continue to move forward, we all need to be part of that solution and get the vaccines done. We also know that that we're bringing back our high school students on May, coming up soon, as the governor has been announcing and the Department of Education has been announcing that schools are going back. We know that right now only the Pfizer vaccine is eligible for is an eligible vaccine for young people between 16 and 18 years old, and they're in the process right now waiting for their EU to move forward that they can actually go down as far as 12 years old. So there's going to be additional populations that grow in that, and more people are going to become eligible for it. We need to continue that vigilance to make sure that people continue to get their vaccines, and everybody helping out would be great. Beyond once we get there, and I think Massachusetts is going to do better and be better, we don't know what's going to happen with that. I think most people have heard that there's some discussion from a couple of our attorney generals and a variety of others who are looking at some of those areas. But at this time, we're hoping that more and more people will voluntarily get the vaccine and will be able to move forward. So it doesn't have to do, we don't have to do any kind of pressuring to look at that.
Yeah, it's a good point.
You
mentioned. Oh.
No, go ahead, Matt. I'll add after.
I was going to say, Doug, it's a good point. I don't know what the percentage of population of Somerville is ineligible for vaccines. I'm guessing it's probably 10% or something for people who are under 16. So like there is a ceiling already, right? Like Somerville can't say we're going to get 100% vaccinated because 100% of people can't take it yet. And like my business is 21 and up only. And of the 20 and up population, I think 64% in Somerville as of data last week have already had their first dose. So if you assume everyone's going to continue on their second dose, 3 weeks from now, 2/3 of the population that my business could get in Somerville is already vaccinated, which is great news.
Mayor, did you want to add something, or shall we go to the next question?
Did you ask me, Tom?
No, the mayor was about to say something, and so
I was going to, but I don't know if it's. Let's go to the next question because I don't know if you can all hear me well because it might be my connection.
All right, we'll move on to, we had Zach Baum as the next question, and that'll be followed up by Adrian Thompson, and then we'll answer a few questions that are sitting in the chat.
Thanks, Tom, and thank you, Mr. Mayor. I've got two quick questions. The first is, are restaurants, as of May 7th, are restaurants able to host performances indoors? And the second question is the city following along with the state's relaxed outdoor mask policies?
So does Doug or Nick want to take a stab at that?
Sure, sorry, my computer was not unmuting for some strange reason. If you watch my eyes shift fast, you'll know why. Yes, we will be following some of the same guidance that the state has been talking about regarding the mask mandates. So I think that's an important piece to look at. We want to continue to move forward with a lot of that, and all that was announced earlier this week as well. And I'm sorry, I was losing you a little bit on the first question.
Sure. The first question is, as of May 7th, are restaurants allowed to host performances indoors?
Sure, I'll start, and then Nick, if you want to take on from there as well when it comes time to some of that. Indoor performances will be allowed except for certain areas that were just outlined that Tom did in the slides, which include some of the singing and the wind instrument type things. And part of that is because we know the spacing within that. We also know about the droplets, and that's what we're really being cautious for.
Fantastic. And to confirm, the standard is for outdoor singing with masks, singers need to be 25 feet away from guests. Is that correct?
Yes, that is correct.
Excellent. Thank
All right.
I'll take on
Adrian.
a couple. I was going to say, Tom, I can take on a couple of these that are hopping up in the chat here just to clarify some of the restaurant stuff.
You want to answer them directly, or why don't we get to Adrian's question? You can take a look at those in the chat. Adrian, go ahead and unmute yourself.
Thanks, Tom. Good afternoon, everyone. Thanks, Mayor, for putting the call and giving us the opportunity. Delighted that we're able to go to phase 4, step 1, and further our reopening, which is fantastic. Very excited about that next week. Obviously, Tom, you mentioned earlier we need a bit of time to digest a little bit further the state's reopening timeline and plan. My question for the Mayor is, once you and your team have had an opportunity to do that, Mr. Mayor, will you follow suit with both the state and the City of Boston with announcing a hard timeline towards reopening with specific dates for the specific phases? Obviously, that's provided that the data continues to trend in the right direction. Clearly, something we've spoken about from day one is having, that line of sight on where we're moving to, and it's certainly very useful to have that from a state perspective. And can you provide us with the same assurance that you'll provide that timeline once you've had a chance to digest the information provided by the state?
Once we've had time to digest it and we're confident in it, we will. Again, the state does not inform the municipal leaders or health boards why they're doing what they're doing. They just announce it. That's been their MO all along. That being said, as I mentioned earlier, and I appreciate the question, we are cautiously optimistic. And I'm hopeful. I don't want to jinx us here. Keep our fingers crossed that announcements won't come weeks down the road, but sooner. And once we're going to continue, we're already monitoring, we're already analyzing. Let's operationalize what we put in place here. And again, I'm optimistic we'll be meeting more often and updating you regularly. In the moment we feel confident in something, we can give you greater runway and line of sight, we'll absolutely do that. Not ready to do that today, and we don't know to what extent that will be. We want to be honest and accurate in what we tell you. So again, but I say this with a positive tone, I hope, but under the caution and contingency you mentioned in your statement as well.
Absolutely, thanks. Appreciate you need the time to dissect the information, and if I could advocate for anything, it's just having that timeline is really useful. So as you're making those decisions, if you feel that you're in a position to do that, I know that all the businesses on the call would certainly really value having that timeline that we can work towards, knowing that there's the caveat that the data has to continue in the same direction. So thank you very much.
Thank you.
Thanks, Adrian. I'm going to jump into the chat and just ask them out loud and see if we can get some answers. We got a question from Jack Conley, which is, when will city offices, buildings, etc., be staffed in person? Will city employees be required to be vaccinated? And how will you encourage reluctant citizens, especially our immigrant populations, to be vaccinated? City offices first.
I'm going to start on that. We don't know the timeline on city offices. There'll be more to come. We're assessing some HVAC and air handling systems. Jack, I'm sure you know all the outreach we do with the Immigrant Services Unit. We're doing that now. That's how we're going to continue to encourage the vaccination. And the businesses, the partnership with the business community has been impactful. We ask you to continue that, and we thank you. Putting those signs up about being fully vaccinated, reinforcing the positive message about vaccines and that vaccines work. So we're going to continue our outreach and engagement that we've been doing so for months now in advance of the vaccine rollout. We're also excited. We're going to get some allotment in our regional site here that will have more equitable access for our local residents. So as you can see by the trends, we're making progress. We still want to see greater progress with the vulnerable populations, but we're going to continue to work with our partners in the community. Different service agencies who deal directly with immigrants, or anti-poverty agencies, those who've been working together with our Immigrant Services Unit, as well as other partners and stakeholders to help us educate, engage folks who may have hesitancy, or just help them through the process and bureaucracy of being pre-registered. The system works great when you get to the site. You still got to pre-register and work an app. Now, system set up for people who know how to stand in lines. Those who don't know how to get into line, it's a problem. I'll have to drive up to another site. So we're working on that and we'll continue. We'll more to come on city offices and what that will look like. We don't have an answer today. Thank you.
We got another question by email yesterday that I'm going to read. It was related from Avenue Bar and Kitchen and Bar. And the question was, since the reopening is or should be based on vaccination percentage of the people, what percentage do we need to open to 100%? Because I'm assuming that we will be there at that point on August 1st when the state is going to fully allow businesses to open up. So
We're not going to
address that?
Doug, you can add it. We will not be, unless I misunderstood the question, we don't expect to be at 100% vaccinations on August 1st.
Well, I agree. I think we have to be realistic. We're never going to be at 100%. There are going to be some people who are not going to be able to get the vaccine for a variety of reasons. They just have allergic reactions to one of the things that might be in it. There's always going to be some sort of reluctancy, but I would agree. And some of the stuff the mayor was just talking about. First, I do want to say thank you to all of you who have put the posters in your windows and talked about the vaccines and continue to push around the vaccines and continue to get that compliance. We really want to try and push as many people getting vaccinated as possible. This isn't just about opening up. This is also about trying to eliminate this virus completely, or as well as we are able to. My guess is that this is going to be around for many years. It's just that we don't want it to mutate or get additional variants, so that we're going to have to fall back into some of the old ways that we had to look at things. And the way to do that is really to keep people, get people vaccinated so that it doesn't have an opportunity to mutate and change itself. Because if it doesn't have a host and if it doesn't have places where it can actually do that, we're going to be able to slow that completely. It's going to take all of us to do that. So the messaging still has to continue about we all need to be vaccinated. And when we aren't vaccinated, we need to continue to follow those and be vigilant about wearing a mask so that it's not spread that way as well, and doing our social distancing. Our work isn't done yet. Thank you for all the work you have done. Thank you for our community members who've been doing it. But we need to keep that vigilance up and continue to do that work.
Thanks, Doug. I got another question in the chat from Dylan Todd. I'm going to address that one. Then I'm going to switch to Steph Amon, who's got his hand raised, and then we'll answer a question from Joe Carrero in the chat. Nick and Tinovica, if you could unmute, I'm going to ask these questions. You've answered some of them in the chat, but just so everybody hears them. Question number one, for clarity, restaurants will need to resubmit their entire health and safety plan, even though only a change will be to their revised floor plan, or can they just submit their floor plan as an update?
No, it's just the floor plan. Nothing else is changing as far as the protocols and cleaning. We all know that you're doing that and keeping good tabs on that. So the only thing that would change is the updated floor plan.
Second question, if every restaurant resubmits, we've got 180 restaurants, we're 7 days out from will we get our approval in time from ISD to be able to open up with expanded seating?
We're just looking at the updated floor plan. What we will be doing is similar to what we've been doing with the outdoor seating, is that you'll upload the floor plan and then we will follow up in the next couple of weeks just to confirm that the layout meets the requirements. So we'll have those in there, but we're not here to look to delay people from being to do that. We all know that you understand what the spacing is. We've been doing this for a year now. So we're gonna take a little bit of trust on our part, let you do the layout, submit the layout, and then know that we will be there within the first couple of weeks to confirm that it meets the requirements.
Thanks, Nick. A third question was, any update on the 90-minute maximum for restaurants for seating people? Will this stay in place for the foreseeable future?
At this point, this is still a state requirement. It is still a state requirement until the earliest at May 29th. As we stated before, we are evaluating those changes over the next couple of weeks. So at this point, it is still in place, and we may have an update in the next couple of weeks.
And one final question from Dylan Todd. Any timeline on approval for bar seating?
Again, that's the same timeline as the 90 minutes. It's not into effect for the state until May 29th. So we'll be evaluating that at the same time we're evaluating the other aspects that go in effect in that time frame.
Thanks, Nick. Steph Amon, can you unmute yourself and ask your question?
Yeah, thank you so much, Tom. I appreciate it. I also just wanted to thank the mayor for having this small meeting. I know it's very important with everything that's going on. Just being able to stay in contact with you guys is really important. Mr. Mayor, I'm going to give you the brunt of this this question. I'm pretty sure Doug will be able to pick up most of it, though. But with the August 1st reopening, is that a solid school will be opening in September? Just wanted to get that out for a couple of families that were asking.
We don't have a school announcement yet for September. I'll say what I said individually. So, you know, I sit on the school committee. It's going to be a school department issue along with the Board of Health. We are cautiously optimistic. It's everyone's goal to get school fully open September. We got a ways to go. We still have a lot to do to get through this school year and get as many kids back. I know people want that answer, but I feel much better about it than I did last year. It's one of very simple words. And if things keep going the way they are, don't head in the wrong direction, every month's going to be better, and we're in a much better place to get everybody back. So more to come. Keep our fingers crossed.
Thank you, sir.
Oh, thanks, Steph. The next question is from Joe Carrero, which is found in the chat. He's got a couple different questions. I'm going to hopefully capture them correctly. How does density impact the 50% rule for indoor restaurant capacity? And for those who have already spent thousands of dollars in safety plans for indoors, when we could use the seating before the holidays and now can't, business like mine can survive on seating 10 people at a time. And he also asks, there's no place for parties waiting. It's not an economically viable model when every other community allows 100% capacity. So I think, why are we only at 50% when other communities are at 100%? Does anybody want to tackle that?
When we're going to look at this, the big thing that we want to keep in mind here when we're talking the percentages, 50% versus 100% versus 25%, the true restriction that we really have in place here is our 6-foot spacing. So when we come in and we're looking at these setups, and what we're really looking at is that we're looking for the spacing to make sure that you have the proper distancing between the spaces. When it comes down to those items, in reviewing all of the plans that we have here and looking at the setups, there's a small handful of establishments that will actually get over the 50% once we look at the spacing. That's why we are looking at this going through. We want to look at that and then see that the 6-foot spacing is going to be the controlling factor that comes in. So we know that the percentages are there, but we want to focus on the spacing and how those are laid out to make sure that we have the proper walkway paths and distancing in that standpoint.
Okay, so that's totally confusing to me because you're insisting that we're at capacity. I spent $5,000 plus to put 8-foot barriers between every single one of my booths. I have a 15 feet distance between my booths from on the left side of my restaurant and the right side of my restaurant. And but you've been telling me I have to be at 25% capacity. I actually had somebody from ISD come in and challenge us as to whether or not we had more than 6 people in the restaurant. This is ridiculous, Nick. Like, that's not clear to the business community that if my safety plan shows that I'm at 6 feet and I'm meeting all of the guidelines, that I could have more than people in there. I'm making $200 a day because I'm limited to 6 people. I'm turning people away and they're going elsewhere because I have to tell everybody that 25% of my capacity is 6 people. So, I mean, this is what it makes me so frustrated. Excuse my tone, that like, this is insane for a business owner to be able to manage this. I submitted a plan. We went to huge measures to make sure that every single person was safe. Every single barrier was put in place. You guys inspected it. Everything was fine. Then Christmas comes. And then we have limited capacity. Nobody's told me that if my safety plan allows for the 6 feet and is totally okay, that I could potentially have that. And to have an officer of the city come into my establishment and question whether or not we had more than 6 people because we had 2 people waiting for takeout. I mean, this is ridiculous. And I'm sorry for my tone, but I'm sitting here listening and I'm all about public safety, but this is just, as a business owner, this is just not sustainable. You're going to lose businesses in the city unless you are much more transparent and you're much more clear in the way that this is meant to be. I asked that at the mayor's conference are we sure about this 25% capacity? And Nick, you told me specifically, yes, you have to be at 25% capacity. I went to bat with my general managers and argued over this, that no, we have to be no more than 6 people in the restaurant at a time. And takeout, we have to try, if we have more than one person coming in for takeout, we got to count them as a person in their restaurant, because I don't want to be shut down for excess people. I mean, this is so frustrating to me as a business owner, to live with this lack of transparency and the constant changing of rules. And I don't know if I stand alone in the city. Maybe I'm just the loudest mouth because I grew up there. I don't know, but I mean, I hope my other people will stand up. And if you want me to shut up, then I'll shut up. But I mean, I have to say my piece. This is just ridiculous.
Well, let me respond first. You don't have to shut up. We don't want you to, but I will push back on the transparency. I think we've taken painstaking measures to be ethical and honest with folks. And we understand you're not going to like, you're going to hate a lot of our decisions. And I'll just say, and I'll say it again, spent the last year plus giving you the best of the worst decisions we can make. And at the end of the day, it's about keep people safe. I understand. We will take that feedback and whatever and try to address any issues that particular to yours in mind and be responsive as possible. But by no means do we want you to shut up. Please speak up. We're here to listen. And we appreciate that. We're trying to get through this together. So we'll try to answer that question. Nick, if you have anything, you respond to that now to help give clarity. But we've done nothing but put information out for everyone to engage with everyone in the community, whether the information is good or not, and we'll tell you what we know. We'll tell you what we don't know, and I'll tell you no when we're not going to do it if it means risking people's health and safety. Go ahead, Nick.
So, and again, I apologize for some the confusion that's here, and I understand your frustration because we are all frustrated. Part of the confusion is coming from the guidelines that we were getting from the state. So when you went back and in the original one where you were set up and you were allowed to have barriers and we were at 40%, that was all items that were permitted by the state and what the state was moving forward with. When there was a November lockdown, we were following the state requirements to come in and shut down the seating and go back to where we were. Then when we started opening up again, we were moving forward with the state. We went up with the 25%. I know that we were lagging behind slightly, but we ended up getting to the 25%. When the state moved forward to the zero capacity, the difference that they made and that we're looking at here is that they removed the ability to have the barriers. So when the state went to 100%, they required all the spacing to put in place, and you could not reduce your spacing for capacity with the included barriers. So again, there was another confusing aspect to it that wasn't taken into place. So we're trying to do this and make it as simple as possible and bring it up to where everybody is so that we're all in the same part. So again, I know that you have barriers up. The barriers were put in the beginning. Right now, the barriers aren't even an available exception through the state. So that's something else that we're trying to navigate through as well, because you all did spend a lot of money for items that the state permitted previously that aren't currently, allowed under their new ones. So that's again, that's what we're trying to navigate here.
But you're the only ISD department that's telling me my barriers are not acceptable. I have 3 other locations who've all come in and said, "Yep, this is great. There's nothing, no changes. You're perfect. You're at 6. This is the first time I've heard that 8-foot high barriers between all of our seating and 6-foot distance between our tables, is not sufficient. Where do you see that, Nick? Because I have 3 other ISD and health departments that have approved my safety plans in other locations, including Chelsea, which is a freaking pain in the ass to get anything approved in. I show me the reg that says that I can't use barriers anymore, because you're the only person who told me that.
So Tom, if there's a particular issue on this one only, then I'd ask this conversation be done directly here. But this is, if we can spend the rest of this time talking, if this is constant on this issue, but there are other questions here and we're off at 3:30 and not to dismissive. If Nick, you can follow up with him directly, that's fine. But if there's more, if this is one that should dominate the rest of the conversation, fine, we'll have that.
Joe, we'll connect afterwards and we'll get to the bottom of that. Does anybody else have any other questions? There's a few more in the chat. We probably have time for about 2 or 3 more questions before we wrap up in 8 minutes. So I am going to, there was a couple questions. Both Matt and Adrian had the question, what is our target number for vaccinations in order to open up to 100%? And I think we've answered that a couple different ways, but go ahead, Mayor.
I just saying, Doug, there's no, like, we don't look at any one factor. That is clearly a important variable where you're given the context of where we are now. There's no hard number. We'll see how we're trending amongst all the other variables and how it impacts, you know, where the vaccination rate is, particularly at this point amongst the most vulnerable in our populations, what that impacts and the impacts on that in terms of people becoming infected, not becoming infected, but in this case, after post-vaccination, becoming ill or seriously ill and on a hospitalization rate. So right now, the race is get as many people vaccinated as possible. So there's no hard number because we're never going to be at 100%.
Can I just follow up on that though, please, Mayor? Obviously, the Dr. Fauci, I think, and I may get the exact percentage slightly wrong, has said herd immunity is around 85 or 86%. If Somerville hits 85 or 86% of its population that is eligible vaccinated, surely that then means the city, or let's say the state hits 86%, then we have reached herd immunity in the state. Surely we wouldn't still be imposing restrictions on businesses if we were reaching a percentage where we were at or close to herd immunity?
Adrian, I hope we get to 85% so we can have that debate. Okay, here's where we are today. Okay, let's get there.
Thank you. Yep,
Thank you.
Vladimir, why don't you unmute yourself? Vladimir's from the YMCA. Why don't you ask your question?
Sure, thank you. So the question I have is, are we still requiring health and fitness centers to operate off of a reservation system? Thank you.
No, not off of a reservation system. We're raising up to the 50% capacity, but you would still have to, at this point, there is still the requirement for the contact tracing. So you'd still have to have a list of your guests.
Yeah. And let me just add to that. That's important. Vlad, good to see you, by the way, long time. Thanks for the question. Again, folks, COVID's going to be with us. Hopefully now we get enough people vaccinated, back to Adrian's point, that we're herd immunity, we can, serious illness drops dramatically. But it's going to be with us. We need to monitor. We just don't know. We don't know what it's going to come back like. Fall, they expect a slight uptick. What's that mean? We have no idea. Look what's happened in India. Does it mutate to a level and bounce back here? So a long way to go. So, contact tracing, all the things, being smart, following the guidelines, even as they evolve, is critical for everyone.
And if I could just add something to that regarding some of the contact tracing is a critical part of this. I think, as we start opening up and as we see that, and we see more people floating around the community and doing all those other things, contact tracing is getting more and more difficult because we're not able to really necessarily identify where people might have been and where they may have been exposed or how people might be exposing others. So please, if you can keep track of all of those things when in your restaurants, doing your reservations, making sure you're holding on to those, that just makes our jobs a little bit easier. But it also allows us to keep our doors open. If we're not able to start tracking things and be able to follow things, there's a chance we're going to go in the wrong direction. That's not the way we want to go. Again, this has to be working with all of us together so that we can make sure that we're able to slow the spread of this virus down. And that includes, the restaurants, the fitness centers, any place where we have our guests coming in, so that we know who might have been there and who may have been potentially impacted or potentially exposed to the virus itself. Because we know that the vaccine itself is not always 100% effective either. That you can still possibly get the virus and transmit that virus. So we want to make sure that we are staying on top of everything.
Thanks, Doug. Beth Shunke has tried to ask a question a couple different times. Beth, you want to unmute yourself and ask your question?
Sure. Hi, my name is Beth. I'm the Director of Operations for Hawkeye Hospitality. We have a couple of restaurants in Somerville and a couple in Boston as well. And I guess my question is that, Somerville is saying that we're in phase 4, step 1 of the Massachusetts reopening guideline. And having read those guidelines several times because I have to pivot for each restaurant location, phase 4, step 1 allows bar seating and also allows non-porous dividers. So are we there and are we following this guideline to the T, or is it going to be a pick and choose for Somerville? And how are we going to know what we're picking and choosing? Thank you.
So if I can start, to be clear, I don't think we've just picked and choose. We've been deliberate and consistent and diligent in our efforts, whether people agree with it or not, and I don't expect you to. It is, as we said, a modified 4.1 because it's not totally there, but perhaps we need to offer more clarification, and Nick, and we can do so. We'll send out an email since we're running out of time, but I want to make that clear on that point. Thank you.
There will also be an order coming out. What came out earlier was the press release, which is a high level detail. By the end of the week, early next week, we hope to be able to have the order, which will provide further detail.
Thanks, Kristen.
So
That's
just
all-
sorry, real quick. So we'll be receiving the modified version of the phase 4 step 1 before we reopen? Before it's time to make these changes?
Yes, it will be before you reopen.
Okay.
That's all we have time for today, folks. However, this is not the end. I see Connor, I see Dylan with questions. Feel free to please email us at economicdevelopment@somervillema.gov and we'll get answers to your questions. We also have a regularly scheduled monthly business town hall scheduled for next Thursday. We have representatives from the SBA who will be talking about the restaurant recovery program that the federal government has released, and we'll certainly be able to answer any more questions about reopening as we have more clarifications with our order issued and with a better understanding of how we may want to proceed in light of the state's recent announcement.
Let me just add a couple of things. Thank everyone for joining. You know, if obviously any policy decision, order, or intervention, you hope it applies the same way to everyone. There are cases, and your input throughout this always, but especially in this past year plus, has guided us where there are situations that are not covered equitably, and that may need to be addressed and can be done so safely. So send that off. Whether it's Joe's issue he mentioned about, or anything else, send it off to us. We do listen in here. We may not agree all the time, but we do listen and pay attention to one. Two, please pre-register for the vaccines here. Some of that's important. As you know, we're going to get an allotment here that is critical. Thirdly, we look forward to talking about where we are with the ARPA funds, ARPA, because we're going to put another concerted effort. As you know, we try to do something bold here in Somerville with several $1 million we put out between direct monies and waive fees. We want to make sure we leverage what's coming down through the SBA and the federal government on top of what else we can do here to help you recapture the economic wins before the pandemic. And thirdly, hope to talk about what events will happen. We have not canceled any of the traditional events for this year. As I mentioned before, they might look different, might be on a different date. We want to start sparking those traditions again. And the updates we hope to give you won't be 4 and 5 weeks away, be sooner. We're in a positive step today. It is a positive step, and we're cautiously optimistic. Much better than the conversations we had in the last several months. I know you're frustrated. We realize that. So give us anything if we're missing. We'll look at it. We can do it in a safe way. I'll end there, Tom. Thank you.
Next week's business town hall will be at 3 o'clock instead of 3:30. So feel free, again, if you are on our email list, you've already received notification and the ability to sign up. If not, absolutely, please send us an email at economicdevelopment@somervillema.gov. Thanks for joining us today, folks, and talk to you soon.
Thank you guys very much.
Thank you.
Thank you.